Good morning to all of those who make this broadcast possible. To Lázaro Manuel supporting us from the studios, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 1,697 people are hospitalized in Cuba. 56 are under observation. There are 1,000 suspected cases and 641 confirmed active cases. Yesterday, we processed over 7,000 samples, 7,138, in our various molecular biology laboratories. 2,398 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 808 in Havana's Hygiene, Epidemiology and Microbiology Center, 548 in Villa Claras, 263 in Santiago de Cubas, 564 in the Genetic Engineering and Biotechnology Center Lab, 451 in the Hermanos Almajeras Hospital Laboratory, 459 in the Manuel Fajardo Hospital, 444 in the Civil Defense Laboratories, 383 in the Molecular Immunology Center, 320 in the Fructuoso Rodriguez Hospital, 265 in the Naval Hospital, 173 in the National Center for Genetics, and 42 in the ICA Laboratories, a facility belonging to BioCuba Pharma. Of the 7,138 samples processed, 42 tested positive for COVID-19. That's 42 people. This brings the total number of samples processed in the entire country since the pandemic began to 469,431, of which 4,593 people, or 0.98% of all cases, have tested positive for the virus. As I always mention, samples from all of the country's provinces and the Isle of Youth Special Municipality were tested. 277 from Pinar del Rio, 117 from Artemisa, the most, 4,735 from Havana, 244 from Mayabeque, 119 from Villa Clara, 101 from Sancti Spiritus, 1,141 from Ciego de Ávila, 101 from the Isle of Youth Special Municipality, despite reporting no new cases for several months, and so on and so forth from all of the country's territories. All of the 42 positive cases diagnosed yesterday are Cubans. There are 41 autochthonous cases and 1 imported case. 33, or 78.5% of the positive cases diagnosed yesterday are confirmed case contacts. This means that 89.2% of all diagnosed cases in Cuba had contact with someone who had previously tested positive for the virus. This is a high-risk group, which is why we are working hard to trace and test all confirmed case contacts. Of the 42 cases diagnosed yesterday, the source of infection linked to 8 is yet to be determined. This means that the source of infection in 63 cases reported over the last 15 days is still being investigated. Yesterday, one person to have tested positive for the virus contracted it abroad, meaning that imported cases stand at 429. Of the 42 diagnosed cases yesterday, 19 are male for 49.9% of all cases, and 23 are female, representing 50.1% of all diagnosed cases on the island since the pandemic began. 19 of the 42 cases yesterday were asymptomatic at the time of testing. Overall, 58.7%, that's practically 60% of all positive cases on the island since the pandemic began, have been asymptomatic at the time of testing. By age group, 3 positive cases diagnosed yesterday are under the age of 20, for a total of 478 children, or pediatric cases, to have tested positive for the virus in Cuba. 395 of the 478, or 82.6% of which have responded well to treatment and been discharged from hospital. Meanwhile, 13 people diagnosed with the virus yesterday are between 20 and 39 years of age. 20 cases are between 40 and 59, and 6 are over the age of 60. Of the 42 cases diagnosed yesterday, 18 belong to Havana, 15 to Ciego de Ávila, 3 each to Cienfuegos and Mayabeque, 2 to Sancti Spiritus, and 1 case to Matanzas. As I previously mentioned, 1 of the 42 cases diagnosed yesterday is imported. This case belongs to the municipality of Cienfuegos in the province of the same name. The 3 cases from Mayabeque belong to the municipalities of Nueva Paz with 2 and Mayabeque with 1 case. The 18 cases from Havana belong to the municipalities of 10 de Octubre with 4, Centro Habana with 3, Boyeros 3, La Lisa 3, Arroyo Naranjo 2, Cerro 1, and Plaza de la Revolución with 2 cases. The 1 case from Matanzas belongs to the municipality of Cárdenas. The 3 cases diagnosed in Cienfuegos are from the municipality of Cienfuegos. Remember, one of these cases is imported. Both cases reported in Sancti Spiritus are from the municipality of Jatibonico. The 15 cases from Ciego de Ávila belong to the municipalities of Ciego de Ávila with 8, Baragua with 3, Florencia 2, and Venezuela also with 2 cases. Yesterday's results therefore mean that Ciego de Ávila has the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 30.20. Havana follows with a rate of 22.20, slightly lower than yesterday. Artemisa's rate also drops slightly to 13.79, as does Matanzas with 3.47. Pinar del Rio has a rate of 1.37, Mayabeque follows with 1.82, then Sancti Spiritus with 1.72, Cienfuegos with 0.49, Las Tunas with 0.19, and Villa Clara with 0.13. This means that Cuba's rate rises slightly as compared to yesterday, now standing at 6.51 per 100,000 inhabitants over the last 15 days. To summarize, of the 4,593 people who have been diagnosed with the virus thus far in Cuba, 641 are active hospitalized cases. 623, or 97.1%, are clinically stable. Yesterday, no COVID-19 related deaths occurred in the country, meaning that the COVID-19 death toll on the island remains at 106, with a mortality rate of 2.31%, lower than the global rate of 3.24% and regional rate, which stands at 3.47%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 65 people were discharged from hospital, a positive result. 51 people were discharged in Havana, 5 in Artemisa, 4 in Matanzas, as well as in Mayabeque, Villa Clara, Guantánamo, and Pinar del Rio. This means that, to date, 3,844 people, or 83.7% of all confirmed cases in Cuba, have recovered from the virus. Today, 6 patients continue to be in a critical state, 4 of whom are being treated in the military hospital in Camagüey. 12 patients are also reported as serious and are being treated in different medical institutions, 3 in Camagüey's military hospital. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 281,921 people were diagnosed with the virus, for a total of 27,891,329 confirmed cases since the start of the pandemic. At this rate, we are sure to reach 28 million by tomorrow or the coming days. Yesterday, 5,904 people died of the virus, for a total of 903,991 COVID-19 fatalities and a mortality rate of 3.24%. The region of the Americas, which accounts for 51.89% of all cases worldwide, reported 110,979 new cases yesterday, for a total of 14,473,717 people to have been diagnosed with the virus. Meanwhile, 3,712 people died of the virus yesterday, for a death toll in the Americas of 502,494 and a mortality rate of 3.47%. Leonardo, could you please pull up the map of the world so we can see how the pandemic is evolving on a global scale? As you can see, the United States continues to top the list of countries worst affected by the pandemic, with 6,359,720 confirmed cases and 190,815 COVID-19 fatalities. India follows with 4,465,863 cases. Then Brazil with 4,197,989. Regarding COVID-19 fatalities, yesterday 1,136 people died of the virus in the United States, 1,172 in India, and 1,075 in Brazil. Leonardo, can we now please see the map of the Americas? In first place is the United States, followed by Brazil, then Peru with 702,776 confirmed cases, Colombia with 686,856, Mexico with 647,507 confirmed cases, then Argentina, Chile, Canada, Bolivia, Ecuador. Cuba places 21st on the list in relation to confirmed cases. Regarding mortality rates, Mexico's is high, standing at 10.7%, while Ecuador has a rate of 9.54%. This is the information we have on the behavior of the pandemic in Cuba and the world.